you. Thank you very much. Hello, everybody. My name is Hiba Salih. I'm a physician from Sudan. And I want to start by thanking you very much for showing up. And by asking you to excuse my English, I actually learned it watching Sesame Street. And this is not a joke. This is true fact. So you're going to see in a while. How can you take traditions and use them in an untraditional way to advocate for health? I'm going to show you how. But before doing so, I'm just going to put you on the stage with the situation in Sudan. Sudan is a country that's been in war within itself for the past 50 years. The North fought with the South, and one of the reasons behind this war was the fact that the North was more developed than the South. The Southern Sudan nation, made of 8 million people, were so badly affected to the extent that 2 million people died as an effect of this war. 4 million people were displaced out of their homes, and the infrastructure that was so little to begin with became even worse. Okay. The infrastructure was really bad. I'm talking about a situation or a setting that there's no roads, there are no hospitals, no schools, no electricity, so it's really bad. In fact, Southern Sudan has one of the lowest health indicators in the world. A survey done in 2006 found that a girl in Southern Sudan is most likely to die during pregnancy or childbirth than to finish primary school. Illiteracy rate is up to 62%. So you can imagine what's the situation over there. And I'm not saying that nothing has been done to improve the health of the people over there. A lot has been done nationally and internationally. But the problem is they didn't have a lot of success. And the reason why they weren't very successful in doing anything or changing the health status of the people over there was the fact that they were going from the top to the bottom. They were functioning on a facility level in facilities, not going to the community. Another reason is that they used traditional tools designed in the North that the Southern people did not understand, relate to, or connect with. So they weren't that effective. As an example of what I'm talking about, this is a typical health poster used for health education in Southern Sudan. And I want to ask you, does anybody speak Arabic or read Arabic for that matter here? No? That's going to be easy to do. Okay, so take a look at this poster. Tell me what health message do you get from it? Does it speak to you? Do you understand anything? Well, if you don't feel bad, because 62% of people in Southern Sudan don't either. And you know why? Because the main message behind this poster is designed or based on the fact that you are able to read what's in the poster. By the way, this poster is supposed to tell you that we are strong when we are united. Let's work together for the primary health care for women. And it's supposed to tell you that it's supposed to encourage a husband to take care of his wife and child. But you weren't able to get that because you didn't connect with it. And this is, as I told you, exactly how people in Southern Sudan feel. This is the real situation in Southern Sudan. This is the real setting that you would expect to find when you go and work in a post-conflict area like Southern Sudan. No paved roads, not much, very limited resources. So what do you do if you're faced with this situation? You have to think untraditionally. You have to keep your mind open for anything. Don't be afraid to try. And you have to empower the community. You have to connect with them. Because when you connect with them, they're going to help you understand the context. And with their help, when you understand the context, with their indigenous knowledge and your background, you're going to be able to identify and utilize the local resources to the maximum. And when you do so, you're going to have a better chance of creating sustainability, which is a very big problem and a challenge facing whatever effort that has been done in post-conflict areas. So we understood that. We were a team, 7 physicians from the University of Medical Sciences and Technology in Sudan, and we understood what we wanted to do. We knew how to do it, and we wrote a project for an organization based here in the US called Global Health through Education and Training Services. And this organization is really unique. They are unique because they believe that the best way to improve health in developing countries is through working with the community. We went to the South and we started with 15 women. Most of them were illiterate, 15 women from 15 different villages. We started the empowerment process by simple games, non-language dependent, because most of them didn't even speak the same language that we spoke. They had their own tribal languages. In this picture, for example, you can see the woman lined up, and this is our supervisor, by the way. Don't be startled by his presence. So we had one rope, and we passed the rope from woman to woman, and we asked each woman to pull the piece of the rope that she has. And as she did so, the rest of the group moved closer to her. So we were able to practically show the women that they are part of a network, that they mattered within their community, that anything that happened to them will affect their immediate family and their community as a whole. That made us very close to the women, by the way. Next, we wanted to understand how was it to be in their shoes? How did they live their daily lives? So we gave them disposable cameras, nothing fancy. We taught them how to use it. And we asked them to take pictures of their daily life and activity for a week. When they came back and we had the pictures, we asked them to describe, why did you take this picture? What was in this picture? Why was the person or the area that you took a shot of was important to you to be in that picture? And by doing so, we got a deeper understanding of their beliefs and their attitudes and their life. And that made us kind of connect to them and relate to them. Then they were at a stage where they were able to identify issues in their community that was affecting their health adversely. They were able to design tools to address these issues. And that was really amazing, because not only that we felt that we trained them, they taught us something as well. Next, I'm gonna teach you a song. I hope you are better singers than me, because one of the things that we really realized about that setting was that dancing and singing was a very important part of their traditional culture. So I hope that you can sing with me after the slideshow's on. So I'm gonna try my best here, and I hope you try with me, okay? La 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 ya baba yo. Mata dugu mama yo. Mama hiya hamlana. شيلوا مشاكل بتاعك ده. Oh, you're good singers. So this song was written by the women, sang by the women, and it was distributed. And it has a very simple and basic message. And I'm going to tell you the translation. It means, no, no, daddy, don't hit mommy. Mommy is pregnant. Please solve your problems and take her to the checkup. So you see, it's a very simple thing, very basic. You don't even think about it if you're not in that setting. You don't think. They were able to identify domestic violence as an issue that they wanted to change. And they were able to figure out the best way to change it through songs. And they went on to their communities and they taught that song to other members within their community. I want you just to imagine something. We started 7 physicians, okay? And we trained 15 women, most of them, as I told you, illiterate from 15 different villages. And within less than a year, about 6 visits, we ended up with more than 55 men and women. They wanted to come and train. And we trained trainers. So we have that multiply effect going on. The message that I want you to get out of this experience, whenever you are in a limited resource area, remember to keep an open mind, empower the local community, They will help you understand the context, and when you understand the context together, you are going to be able to identify local resources and utilize them to the maximum, and you will have a better chance of sustainability. Thank you very much.